All right, good afternoon, everyone. Thanks for joining us. I'm Teresa Freed, Assistant Director of Public Affairs and Communications for Johnson County Government. We have with us Dr. Sami Ariola, Director of the Johnson County Department of Health and Environment, and Epidemiology Director Elizabeth Holshoe. Allison is here providing ASL. Thank you all for being here. We're going to go ahead and start off by talking about this very special week starting April 5th. It's National Public Health Week. And Dr. Ariola, I'm sorry, if you want to go ahead and start us off.
Thank you, Teresa. It's Monday. We are we are back at it. But I guess before we get into COVID, thank you for giving me the opportunity to talk about this very important week. April 5 to 11, starting today, is the National Public Health Week. And if you don't mind, begin to show the slides that I have. Across the country, we have seen in the past 1 year, maybe more than any time in recent memories, of how important the public health workforce is. Public health, obviously, the past 1 year responding to the pandemic, a lot of people have had the opportunity to see aspects of public health. It's not, even before the vaccine came, public health was responding. People get to understand what epidemiology is. People get to understand what case investigation is and contact tracing. But one thing that is very important in public health is that it is about the people. There's a reason why it's called public health. There's a reason why the word public is there. It's about our residents. It's about building bridges into the community. And that is the theme for this year's 2021 National Public Health Week. Public health, it's about building relationships. It's about understanding the community that we serve. It's about using the resources that are available in the community to create environments that are optimal for health. It's about making the healthy option the default option. It's about being able to walk in the neighborhood and not being afraid of crime or dogs. It is about being able to get access to good housing and adequate housing and good food. Public health is about how we build and run our schools. It is about how we build and run even our prisons. It's about the entire community. It's about having adequate parks. It is about mental health. It is so many things, and we have to collectively define that very broadly. But this year's theme is especially very important. It is building bridges into the community. We have to sustain and enhance existing relationships, but we have to build new ones into our communities. Next slide. We have to build bridges into our communities of color. We have to build bridges into essential workers. We have to build bridges into parts of our community that do not have the adequate resources that they have, and I think the pandemic kind of create really a unique opportunity to identify some of these things. In the past few decades across the world, really been very clear that we can do better in terms of rebuilding public health. Our capacity to address emergencies, our capacity to sustain public health activities even prior to emergencies, all of those depend on how much we invest in health. And so for science, for action, for health, for justice, all of those are the themes and aspects of the national public health. It's about creating a vision where we can have a better world that is more inclusive through public health. It is about creating environments where every single one of us, tall, short, thin, big, whatever it is, can attain the best health that is possible for them. It is about putting our mouths where, putting our money where our mouths are. So health doesn't just happen. So I love the theme that we have from our last public health assessment here, that Elizabeth was part of, which is health happens here. But it doesn't just happen. It happens only because we are very intentional about putting resources into it. The policies that we make, virtually every policy has either direct or indirect impact on health through a concept that we call health in all policies. So when we are making budget decisions or decisions about approving projects, about housing, about planning, all of those, about transit, all of those ultimately impact health. And that's that consideration of health and the potential impact on health is something that we have to be intentional about. Across the country, we're spending less than 3% of our money on public health. And at this point, we do need to make a different, I think somebody's on there. Okay. We do need to make a distinction between healthcare and the public health that I'm talking about. A lot of money we spend on healthcare. And I'll tell you, data does show that we spend more on healthcare than any other country in the world. And yet we are ranked in the bottom lower half across the world in terms of countries with better health. But those countries with good health invest in aspects of health beyond healthcare. They invest in what we call social and economic determinants of health. They invest in housing. Those impact health. They invest in good schools. They impact health. They invest in the ability of their children to have access to broadband and internet to be able to learn and to be the best they can be. They also invest in fairness. Racism is a public health problem. When we disenfranchise people, they cannot be the best they can be. Those are the things that we are going to be working on as a county. And again, we talk about the pandemic. It's about using science to make good decisions. So wearing masks is very, very important. It is the reason why we are where we are. We have had the vaccine for about 3 months. Yeah, towards the end of December. The numbers that we saw in January is not because of vaccination. Those numbers are because of people wearing masks, people physically distancing, and the work that our EPI team under the leadership of Elizabeth have done in terms of case investigation and contact tracing. And so if we invest in public health, for example, one example is the Affordable Care Act. By that policy alone, by that act alone, we are saving lives, 19,000 estimated by expansion of Medicare. When people are poor, their health is poor. And so when we invest in policies that take people out of poverty, you improve their health. And so those are the things that, as a county, next slide, we have to continue to do. And so as you join us this week, I am asking that anytime that you see any of our public health workers who have spent countless hours, day, nights, and weekend this past 1 year, please appreciate what they have done. And collectively this week, there are themes for different days, and they showcase some of what I've been talking about. Today, we're talking about rebuilding public health infrastructure. Tomorrow, we'll talk about advancing racial equity. And then Wednesday, about strengthening community. Thursday will be about climate justice. Friday, it's constructing COVID-19 resilience, which again is all of the things that we're talking about. It's about wearing masks. It's about testing resources. It's about those orders that we put in place to ensure that we're able to do those things. It's about physical distance. It's about the work that we have done with our schools. And Saturday, we'll be talking about mental health. We have been saying for the past 1 year here collectively, along with our mental health director, that public health is mental health, and mental health is public health. And on Sunday, we'll be elevating our essential and health workforce. So join us at what's trending. I've checked that a couple of times today is hashtag NPHW. Join us in promoting public health, especially in Johnson County. Let's show the world that health is very important in Johnson County. Thank you.
All right, and I will add in there today, we have a new Joko on the Go podcast episode all about Public Health Week, if you want to learn more about that and the impact housing has on public health. In addition to that, you can follow our social media accounts, which I know a lot of you already are doing, but we have great information coming out every single day focused on those different topics, messages from our Johnson County public health experts talking about those different themes. So be sure to follow that. So back to our vaccine discussion, if you want to go ahead and start us off with just a look at what we're doing this week and what doses we have this week.
Yes, so this week and next week, I'll talk about both. Very, very busy for us, but in a good way. We are having a lot of appointment opportunities for our residents to get vaccinated at our clinics, while there are simultaneous clinics and vaccination events that are happening with us and also our partners. So this week we have clinics open tomorrow, Tuesday, Wednesday, Thursday, and we are expanding clinic hours for those 3 days from 9 a.m. to 7 p.m. And each of those days between the first and second doses, the target is to vaccinate 3,000 persons every day. So 9,000 vaccinations in 3 days, Tuesday, Wednesday, Thursday, 9,000 vaccinations. Then on Friday, there's a second dose clinic that will be vaccinating about 500 people. And on Saturday, there's a first dose clinic from 9 to 12, where we'll be vaccinating 900 persons. So collectively, in our clinics this week, we are going to be vaccinating just under 11,000, providing just under 11,000 doses in the county. And that's not counting our transportation clinic on Thursday, and also our homebound vaccination, which very, very happy to, I was getting the update before I came in today. Last week, we did 44 such vaccinations, and 66 are scheduled for this week. And that's very, very, very good. We also have been partnering on that program with the Meals on Wheels program for the Area Agency on Aging, and those data are starting to come back. And as we get those that have not been vaccinated, we'll add them to those programs. I should state that for tomorrow and all of the clinics that I've mentioned, they are by appointments only. And I know that Tuesday, Wednesday, Saturday, of course, Friday, that second dose clinics are completely filled up. And I think the Thursday clinic by now is about filled up. I know there are enough persons to fill those appointments now. So if you don't get the appointment this week from us, you could this week get appointments with our other partners who are vaccinating. I know several of them have increased the number of vaccines that they are giving out. Virtually all of our health systems are vaccinating this week. And and that doesn't include the vaccinations that are going on with our local pharmacies. They're virtually all vaccinating. This past Saturday, Heart to Heart was our partner that was vaccinating our utility workers as well as other residents, including some of our essential workers and minority populations. And that's one thing that we need to talk about more. We have several of our health systems that are going into specific parts of the county and vaccinating. All of those are ongoing. And next week, just in case you don't have time this week or you didn't get an appointment this week, next week is even better. We're going to have clinics next week on Tuesday, Wednesday, and Thursday, 3,000 doses each day. A lot of them first doses. There's going to be a second dose clinic for about 1,200 residents on Friday, and there will be another clinic on Saturday for about 900 persons. Also, totaling about 11,000 vaccinations that week. About 8,000 of those appointments next week for us are first doses. So lots of opportunities to get vaccinated. And I believe that those appointments are going to either go out later today or go out very early tomorrow. And Elizabeth can get into, after this, just talk to how you can book the appointments, how you can ensure that you are on our list. I think last week she mentioned that we feel like in the next few weeks, we probably will have gone through all of those people that are on our list. And so but we know there are many, many more people that needs to be vaccinated. So if you have not completed our online survey, she'll talk to you about how you need to do that. Right now, your chances of getting an appointment has increased a lot. We are going to be getting just under 19,000 Pfizer doses this week. We expect to get some Johnson & Johnson vaccines. We expect to get some Moderna. So collectively, we could have as many as 21,000, 22,000 doses coming into the county, not counting the ones that's going to our pharmacies. So lots of opportunities to get vaccinated. So I would yield to Elizabeth now just to talk through the appointment booking system, online survey, and any other thing that I might have missed in the plans for the next couple of weeks.
Thanks, Dr. Arriola. And even though you didn't say I could talk about it, I'm going to talk about it anyway. I'm going to piggyback a little bit on the National Public Health Week. Dr. Arriola is right. All of those pieces are integral in the work that we have been doing at the health department pre-COVID. To me, it's a little more special this year because people actually know what public health does in a way that they didn't understand a year ago or 15 months ago. But if you're interested in learning more about Johnson County's overall health, if you want to hear about how housing or schools, cost of childcare, the economy, anything about that and how that impacts our residents' lives here in Johnson County, how your neighbors are being affected by these various components, we would invite you to go to healthhappenshere.joco.com. That is our community health assessment, and it talks about all of these different pieces and how they are impacting our residents' lives, and how we're starting to approach making the healthy choice the easy choice, and working with partners to really move these pieces forward, which I know Dr. Arriola, myself, and our whole team is very excited to get back to as we are able to wind down the COVID-19 pandemic here in Johnson County. But back to what everybody else is showing up for is vaccination information. If you have not filled out our online survey, if it doesn't matter who you are, as long as you are 16 years or older, if you are interested in getting the vaccine, we would invite you to go to jocogov.org/interest survey and fill this out. If you've already filled it out once, you don't need to fill it out again. If you filled out our survey, a couple months ago when you're in phase 2, you don't need to fill that out. We have your information. I believe this week we will be able to get through the rest of people who are in phase 2. We have about 20,000 people on that list. But as we were sending emails last week for this group, we found a lot of people had already gotten their vaccine, which is excellent. But we wanted to make sure we could get those appointments filled up for this week. So all of the rest of our phase 2 people should be receiving emails this week. If you have not filled it out, again, that's jocogov.org/interest survey. And this is really giving you an opportunity to have a designated appointment time that you get to choose. So instead of sort of going and having to click the button and the refresh button 100 times and trying to find that open spot at a local pharmacy, this invite comes into your mailbox. So I would also recommend you check your junk email, maybe once a day, and just make sure you didn't get anything from Johnson County. We do know that some of them are going into that spam folder, but this is how we can invite you to sign up for an appointment. So fill out our appointment. As Dr. Arriola said, we have a lot of appointments this week, a lot of appointments next week, and all signs are pointing to us having an increase in vaccine doses coming into our community. And so really great news for us, really great news for our residents. And we're just excited to get everybody who wants a vaccine that shot and get them protected.
Right. Thank you. The other piece, I'm sorry, Teresa, to add to next week as we walk through our data, not only are we going through all of those that are remaining on phase 2, knowing very well that many of them have been vaccinated, but we don't want to miss anyone, is that we're continuing to look at our data, and as we are inviting people, there are subtle elements that Elizabeth and our team are looking as the invite persons. So for next week, we are really focusing on inviting all those that have completed the form that are 50 or older. So, and other times we focus on other aspects of health conditions or minority population or essential workers. So all of those are things that we look into. But by and large, in the next couple of weeks, if you have completed our form, we feel pretty confident that we would offer you an opportunity to get vaccinated. And our partners are vaccinated, so if you've been vaccinated, that's fine too. But next few weeks should be really, really good in terms of appointments for the county. what a difference a couple of months make compared to when we just did not have enough vaccines. So pretty happy where we are.
Yeah, and not to take away from this positive focus, but we are coming off of a holiday weekend. And I know in the past, after holiday weekends, we've talked about possible surges in cases. So is that something that we're anticipating even after so many people have already been vaccinated, or do we need to be watching for that?
I'll let Elizabeth take that. Yeah.
You've already talked a lot today. So, you know, I have stopped trying to predict what's going to happen. We expected to see a jump after Christmas and New Year's and the winter holidays and Hanukkah. We didn't see that. But I think that there were some very intentional moves by our community to prevent transmission at that time. People were getting tested ahead of seeing their families. I think they understood that they really needed to do these steps. You know, our counts are down in Johnson County, but we do still have a moderate level of transmission, even as defined by CDC. And so I think it's completely possible. I'm very hopeful that the nice weather this weekend kept people outside predominantly. So, you know, we're just going to have to wait and see how this goes. We'll be continuing to watch our numbers over the last few weeks. It stayed very, very steady. But we know that from other parts of the country, particularly the Northeast, they're really starting to see an uptick in positive cases. Now, one thing I would say, though, is that if you are feeling sick, and even if you think it's maybe just allergies, I know allergy season is upon us. If let's say that you're experiencing some allergy symptoms and you've never had allergies before, please go get tested for COVID-19. It is still circulating. We heard that a lot in the fall. People thought it was just allergies. They continued about their daily lives, and then they exposed a whole lot of people to COVID-19. We have a lot of testing capacity in the community. Here at Johnson County, we're testing on Mondays and Thursdays, and our testing numbers are way down. So it's a little hard to feel overly confident in where we are in Johnson County in terms of COVID-19, because we know testing is down. Is that just a lack of people having the disease, or is it a sense of complacency? We're a year into this pandemic. We've got vaccinations that are happening. So it's really hard to say what we will see, but you know, definitely encouraging people to continue to wear your mask, particularly if you're gathering with people outside of your household. If you're vaccinated, you can start taking a few of those steps. But even still, I think we all just need to stay aware that COVID-19 is transmitting in our community. The vaccines are very effective, but there are also variants that are transmitting in our communities too that may sort of alter how effective it is. So you could still be able to transmit the virus, even if you've been vaccinated, particularly with some of the variants. So we'll see what happens. My crystal ball has been broken for a long time, but continue to do all of the public health mitigation things that we've been asking you to do for a while. I know people are tired, but I think that we're moving certainly in the right direction with the massive increase in vaccinations that are rolling out. Our case counts are at least steady. So we'll see. We'll talk to you about this in a week or two.
All right, that sounds good. We know a lot of people are coming up on their second doses, and we've talked about this before, but I think some people are a little bit afraid of that second dose because we've heard that there's a more severe reaction for some people. So what exactly is it that impacts that? Is it the person's health? Is it the type of vaccine that you get? Or what are the factors that contribute to an adverse reaction? Not necessarily dangerous, but just, you know, not wanted.
Yes. So when we get the vaccines, mostly the Moderna and the Pfizer, which are the two dose options, the reactions that we get are not atypical to any reaction that we get from other vaccines. That's the first thing. But the second thing to note is your body reacting is really an indication that the vaccine is doing what it's supposed to do. So generally in our system, when our bodies see a foreign material, there are a series of steps that happens. That includes production of antibodies. It includes other immune responses, the B cells, the T cells, including the killer. And without getting into too much of those technicalities, by the time your body sees this for the first time, this system, if you will, some of them you can classify as surveillance system. That's basically saying, oh, we have seen this before. After the first time, your body is at that level of alert. And so the second time that this surveillance and the other part of the immune system sees that, oh, here it is again, and they're ready to respond in a more intense way to curb the consequences of that foreign material. And that's what you see. Of course, people with that are younger with more robust immune system tends to get more intense reactions. I think there are also indications that reaction might be stronger in some women than in men. There's so many things that we're still learning here. But bottom line is, and those reactions that we talk about are typically very mild, chills and those last very, maybe some mild fever. They last, obviously pain at the site of injection. They don't last for that long. And I took my second shot almost 3 months ago. Honestly, I don't even remember that I have taken it. But that reaction that you see when you take the second vaccine is probably typical of what you will see if you are exposed naturally to the virus. The other questions that we've had is, I've gotten the virus, why should I take it? There's no question that the vaccine elicits more intense immune response than you would from natural infection. There's data to show right now that the vaccines are pretty strong, at least for 6 months. They're still new. We don't know how long it will be. We don't know if we will need boosters later, but they also seem to be pretty effective against at least the UK variant and the South African variant. Now, in the more serious consequences of death, hospitalization, and severe illnesses. Now, there's a lot that we still need to learn, a lot that we still don't know, but there's nothing that we have seen in the reactions to the vaccine that is stronger or seriously more adverse than other reactions to vaccine. So you should talk to people that have taken it. The bottom line is the vaccine is available now, take it. It's not just you protecting yourself, which is very important, but it's also you being part of the community response. We are continuing to vaccinate more people. Part of our goal is to get to that 50% vaccination first dose in our community by the end of April. If we are able to reach that before then, that's great. But to reach that goal and to exceed that goal, we need more of our residents to keep coming in and getting vaccinated. So those reactions are fairly mild. I've seen some people that had to maybe take some pain reliever or some fever reducer after that. There are different schools of thoughts as to when you advise to take that. But bottom line, they're very, very transient reactions and very, very mild reactions that go away very quickly. But more importantly, it's really showing that your body is doing what it's supposed to do. When you see your body sees a foreign substance, your immune system responds, and that's what you're seeing.
Yeah, and just to follow up a little bit, with Pfizer, which is the main vaccine that we're providing through Johnson County, it's about 1 in 8 or 1 in 10, somewhere in there, of individuals who have what we consider one of the more serious side effects or immune responses, where like you really don't feel well, you really don't feel like getting out of bed. So it's pretty rare. It's like 10 to 12%. And so it does seem to occur with younger individuals, but I also don't want people to feel like if you don't have that side effect, if you don't feel anything after that second dose, that you're not protected, because that's not the case either, right? Each one of our bodies is very different. We've all been exposed to different kinds of viruses in our past. And so some people have really severe side effects, some people don't. I've heard, some people who've had COVID recently didn't have any side effects. And then I've heard other people who had COVID had side effects. So it's sort of a shot in the dark whether you'll be one of them, but either way, whether you have them or you don't, there's no reason to be concerned at all about the vaccine or about how your body is responding to it. It's completely natural across the board.
All right, that is very good information to know. Before we wrap up today, I know we have a special guest coming on tomorrow. So Dr. Arreola, if you want to give a preview.
Yes, yes. Thank you for bringing that up. A colleague who has been one of our really strongest collaborator throughout this at KU Med, Dr. David Wild, will be joining us tomorrow and talking through how they are vaccinating, who qualifies for appointments with them. I know they've been expanding, is going to talk about their capacity to vaccinate. And one of the distinguishing things for us in working with our health systems is taking advantage of the system that our residents are used to interacting with. That's where they get their preventive care. That's where they get their health care. And I think that's been very, very helpful. So very happy to talk to our good friend, Dr. David Wild tomorrow. He is going to be joining us for this event tomorrow. So I'll do less talking and Elizabeth, and he'll do most of the talking, right?
Absolutely. That's why we invite people on here with us.
We like hearing from you too, but it's always nice to have this as well, right? All right. Well, thank you all for being here. Thanks for everybody watching online. We will see you back here tomorrow at 4 o'clock. Have a good day.